All right, good evening, everyone. Welcome to the live webinar on how will healthcare evolve post-COVID-19 for breast cancer and lymphoma patients. Thank you for joining us in the Zoom meeting room, as well as the Star FB page. The webinar is organized by the Star Media Group with support from ROCHE Malaysia. I am Dr. Nirmala Bhupati, your facilitator for this evening. I'm a public health medicine specialist from the Faculty of Medicine, University of Malaya. And I'm particularly interested in improving life after cancer and also in development of sound cancer policies for the nation. It is a privilege to have two highly experienced and knowledgeable speakers in the area of breast cancer and lymphoma to share their insights on how healthcare will evolve in these two areas post-COVID-19. Before I introduce the speakers, let me please remind you that you can send in your questions by typing it into the Q&A box for those in the Zoom sessions, and for those who are on the FB page to send in your questions there. We will address these questions after the panel session. Please do keep the questions relevant to the topic discussed today, and thank you. With that, let me now introduce our speakers. First, I've got Dr. Alan Tay. Dr. Alan Tay is a consultant hematologist at a renowned private hospital since 1999. Prior to that, he was an associate professor with the Department of Medicine, University Malaya Medical Center. Dr. Tay's field of practice is in clinical hematology that involves treating patients with leukemia and lymphoma. After his initial training in Australia, Dr. Tay helped set up the adult bone marrow transplant program at University Malaya Medical Center in 1993 and participated in establishing the National Bone Marrow Transplant Recipient Registry. Dr. Tay has a strong interest in digital health and telemedicine. He's a member of various professional medical bodies that include College of Physicians Malaysia, Academy of Medicine Malaysia, and Malaysian Society of Hematology. Welcome, Dr. Tay. And secondly, we have Dr. Yap. Dr. Yap Beng Kiong is a consultant clinical oncologist at a renowned private hospital. He did his undergraduate and postgraduate medical studies in the United Kingdom, followed by a clinical fellowship in radiation oncology at the University of Toronto, Canada. Dr. Yap had served as a consultant clinical oncologist at the Christie National Health Services Foundation Trust in Manchester, England, for over 10 years before returning to Malaysia. He was also a member of the UK National Cancer Research Institute clinical subgroup, designing and conducting clinical trials. Dr. Yap is passionate about sharing his experience and knowledge, that he does this by delivering lectures in various local and international meetings and institutions. One of his areas of interest is promoting public awareness on the importance of early diagnosis and treatment. Thanks for being with us today, Dr. Yap. Healthcare systems are experiencing tremendous pressure due to the COVID-19 pandemic. In its initial phase in the affected countries, medical resources and staff were diverted to respond to the crisis, whereas lockdowns and quarantine had restricted access to cancer care, be it in delay in treatment or cancer screening activities and so on. Nonetheless, governments and health policymakers throughout the world have come to terms that COVID-19 is going to be around for some time. They have also slowly began to realize that ignoring life-threatening non-COVID-19 conditions, such as cancer, for too long may turn one public health crisis into another. Knowing full well that we need to learn to coexist with COVID, healthcare systems have therefore started making adaptations in delivery of cancer care. And we have also started revisiting how care may be delivered efficiently throughout the cancer continuum, right from the point of symptom appraisal to cancer diagnosis, initiation of prompt treatment, and also provision of supportive care for those who need it, cancer survivors. So the Malaysian Cancer Registry for 2012 to 2016 had reported that breast cancer was the most common cancer detected among Malaysians, while lymphoma was the fourth highest, making these two cancers a focus on today's webinar. So without further delay, let's start with the questions for esteemed panelists. Dr. Yap, can I start with you? So first, I would like to ask, what is the risk of COVID-19 infection in patients with cancer?
Thank you, Professor Namala. Certainly in cancer patients, which include hematological malignancy, blood cancer, and other types of cancers, the immune system in this group of patients can be compromised. Whether they are on treatment or the disease itself can reduce the immunity to fight infection. So with COVID-19 is a viral infection, so the ability to fight infection in an immunocompromised or a reduced immunity person obviously is greater than a normal healthy person. So in terms of risk to cancer patient, we may have to differentiate between patients who survive cancer treatment and they are well, just like any of the normal population. And also we have to differentiate between patients who are undergoing active treatment for their cancer, whether it's immunotherapy, chemotherapy, radiation therapy, targeted therapy, and so on. So we know from the countries where the COVID-19 pandemic has evolved, such as in China, in Europe, and North America, there has been a lot of data coming out which suggests that patients with cancer, they are susceptible to the infection and they have a higher risk of mortality in terms of death, and also the need for more healthcare resources such as ventilation, artificial ventilation, intubation, and so on. So these are the real risks for patients with cancer who are especially undergoing active treatment for their cancers.
Okay, thanks, Dr. Yap. Now, can we shift to Dr. Alan? Dr. Alan, can you tell us what are the safety measures that cancer patients need to take in order to protect themselves from COVID-19?
Hi, thanks. First of all, thanks to the organizers for giving me this opportunity on this STAR webinar. And I think it's an important question because we get this from our own patients all the time. And the thing about safety measures are particularly important because, as my colleague Dr. Yap has alluded to, those on active treatment are particularly susceptible to more severe complications should they ever get COVID-19 infection. But the safety measures that they need in order to protect themselves are actually not much different from what other ordinary members of the public should do. And it's actually diligent social distancing, vigorous hand hygiene. I mean, this pandemic will be remembered as the time we learned really how to wash our hands. Face covering or face masks if you are in a closed environment where particularly social distancing is not very feasible. In common sense, avoid large social gatherings, crowds, and other high-risk places, and avoid those who are unwell. And then those who are unwell should not be visiting the cancer patients, particularly if they are on active treatment. I think basically the same, but be extra vigilant. And other general health measures, good general health, keep fit, don't smoke, adequate nutrition, wash and cook your food thoroughly, household cleanliness, etc.
Okay, thanks, Dr. Alan. I have a next question. So can you provide some insights on what are patients' biggest fears in getting cancer treatment in the hospital currently?
I think we've had patients who are very afraid to come to hospital because they were really afraid to catch the coronavirus infection. And rightly so. I mean, they know they are more vulnerable. So I think the biggest problem was in the initial part of the pandemic. We had patients who deferred treatment or delayed treatment or didn't want to come to hospital at all. And this is basically because of the fear of catching COVID-19 infection. I think this needs to, I think this fear needs to be addressed, and you should have actually the risk actually is highly variable, as Dr. Yap mentioned. It doesn't mean that just because you have cancer, they are at very high risk. It depends on whether their cancer is in remission, they are not on active treatment, whether they have rather indolent or very almost benign disease or very aggressive disease, and the type of treatment they're going to have. And actually, there are a lot of measures we can talk about later where this risk will be reduced to a considerable amount. And also, this issue needs to be discussed because it's on an individual basis that whether the patient or not will be at big risk or at little risk, and they need to discuss this with their doctor. But I think from the caregiver's point of view, our biggest fear is our patients do not get the treatment they need, and their cancer actually gets worse at a more advanced stage if they delay the treatment and so on. And certain things like the cure rates and the probability of them doing well depend on sometimes keeping to time and making sure the healthcare is not delayed.
And Dr. Yap, do you have anything to add on to what Dr. Alan has said?
Yes, I think, I totally agree with Dr. Alan. I think the key message really to the public is that if they have cancers, in anyone with cancers, they should really discuss with their doctors in terms of, the risk of them coming to hospital. Because I think delaying their treatment, if somebody with active cancer and aggressive cancer, delaying their cancer treatment can be detrimental. So I think it is important, although there's a fear out there, I think they need to discuss with their doctors, and we try our best to, in a way, to address their fear, and sometimes to get on and to proceed with their treatment is far more important, and especially in those who majority of them do not have COVID-19, and especially in those. What they are worried is, if they get COVID-19, their cancer treatment can be delayed. But so I think it's a chicken and egg situation, really. You really have to address their fear so that they come forward for their treatment. And if they come forward for treatment at hospital, usually, hospital would have certain measures to mitigate the infection, such as the social distancing and so on, that we can, hand washing and making sure that, we keep all the clinics place and examination room clean and so on. So, from the hospital part, we are also doing our part to mitigate the infection. So that's what I think is important for patients with cancer to discuss, with their doctors rather than, being so afraid to come to hospital.
So you suggest that in cases when patients are doubtful about coming to the hospital for whatever they need, they should contact their healthcare professionals, their respective doctors or treating teams to get some degree of, just to allay their fears. So they should be speaking to their doctors or their teams.
Yeah, yes, totally. Because it depends on what stages of their cancer. I mean, some of them is just a routine follow-up, which is fair enough. It can be deferred because they have gone through their treatment. They're just under regular follow-up. So those appointments can be delayed, or it can be with the telemedicine, which we're going to discuss later on. We can do that kind of thing. But for patients with active cancer, especially those with more aggressive cancer, with more indolent cancer, sometimes we say they may be able to delay a little bit. We can talk about other innovative ideas in terms of cancer treatment, in terms of other alternative methods of cancer treatment that we can offer.
Okay, thanks, Dr. Yap. So I'm now going to shift gears a bit. The director of the National Cancer Institute in the United States had recently made this remark that the coronavirus pandemic is a public health event and everyone should be worried about it, including people who run hospitals. He added that they need to preserve capacity and take a proper pandemic response. That's what his remark was with respect to people who run hospitals. So in line with that statement, what are the suggested measures that healthcare providers can put in place to enable patients to seek cancer care in a safe environment during the current pandemic? Maybe Dr. Alan can start.
Yeah, thanks for that question. I think, safety is on both sides. It's for the patients, visitors, as well as the staff. And I think the measures put in place in hospitals are very thorough. Patients and visitors are screened, and it's not just that plastic thermometer which the security guard will put on your forehead and give the same reading all the time in the supermarket. By the way, the joke is that we'll remember this pandemic as a time where security guards took the temperature of doctors. But anyway, in this hospital setting, there are full body thermal scanners, there's health questionnaires, screening questionnaires before to pick up patients who are symptomatic. And also we practice good social distancing in the lobbies, the lifts, the waiting areas, and also at the peak of the pandemic, actually no visitors were allowed in hospitals, and now that is being relaxed a bit. So maybe one visitor at a time, and as the pandemic changes and numbers drop, then the hospital can relax a bit. But these are just to make sure that the risks are minimal to both patients and staff. But I do tell my patient, hospital is a safer environment than the supermarket. Okay, where you have somebody with a dubiously accurate forehead scanner taking a temperature and then letting them in. So I think these are the things which we can reassure patients that it's a safe environment in hospital, as safe as can be. I think the government has done a great job as far as management of COVID to flatten the curve. And actually, we've been very lucky. Look at our mortality rate, the death rates are so low compared to some other countries. So I think we are very fortunate that the health ministry has done a great job in managing this pandemic. And I think everybody, the whole healthcare sector, private and public, have done a fantastic job.
Okay, thanks, Dr. Alan. I think I just have to echo your thought about being hospital being a safe place, because I also used to joke with my family that I feel safer going to the hospital rather than going grocery shopping, because the hospitals really go all out to make sure that patients are in a safe environment. Dr. Yap, would you like to add something to Dr. Alan?
Yeah, certainly from the preparation from the hospital perspective in terms of mitigate this COVID-19 infection, there are various measures, including social distancing and so on. But let's say, for example, patients who come in for certain surgical procedures, for surgery, for endoscopy, for any sort of invasive procedures, they will be screened for COVID-19 infection. So I think that is in line with many hospital and also in line with the Ministry of Health policy, which is to protect patient and protect the staff. Don't forget that we try to protect patient. At the same time, we have to also protect medical staff, the nursing staff, and all the healthcare professional working at the hospital, because these people will go home to their family also, right? They go back home and then go into the community. So the hospital has a duty to protect them as well. So do not forget about that.
Okay, thanks, Dr. Yap. What you say is indeed true. Like, it's not just about patients, but also staff who work in the hospital. Now, every cloud has a silver lining. So we all know that the COVID-19 pandemic had caused a lot of distress all over the world. But at the same time, worldwide, the COVID-19 pandemic had pushed us to adopt innovative delivery of cancer care much earlier than we all had planned to. I mean, like, we all wanted to practice some innovation and do something better. But the COVID-19 pandemic had pushed us fast forward and make us adopt things earlier than we expected. I was therefore intrigued to find out that in Singapore, women with HER2 positive breast cancer were able to get their cancer treatment from their neighborhood clinics, as innovation had enabled the delivery of treatment via subcutaneous route instead of the regular intravenous infusion, which has to be administered at the hospital setting. So, are there such opportunities for innovative delivery of cancer treatments in Malaysia that will decentralize cancer care and improve accessibility to treatment, but at the same time reduce the exposure to the SARS coronavirus? Maybe I can start with Dr. Yap this time.
Yes, I think certainly there's opportunity to be innovative. But for now, in terms of the private sector, all the cancer care delivery is done at the hospital, not in sort of like a van you can go park near to your house. So at the moment, we do not have that. But certainly, I'm not aware that Ministry of Health have any sort of this kind of delivery at home in terms of cancer care, but maybe for other specialty. In terms of there are innovative way in rather than they have to try to reduce the amount of time that patient spend at hospital. So there are various things we can consider. As you mentioned, rather than infusional type of treatment, they can be given in a subcutaneous, which is an injection with skin, it takes only a few minutes, 2-3 minutes. Rather than infusion, it can take to many minutes, up to an hour, 2 hours. There are also, in terms of chemotherapy regimen, we can consider in terms of rather than a shorter regimen, or oral preparation rather than infusional preparation, and especially in breast cancer patient, in terms of surgery. Let's say, for example, when a patient with breast cancer has a lump removed, usually this is followed by external beam radiation. But now we have technology like what we call intraoperative radiotherapy, that we can deliver the radiation at the time of surgery. So this is a one-off treatment rather than the patient having to come back a few weeks later for multiple external radiation, usually 3 to 6 weeks duration, depending on their cancer. So I think there are innovative way in terms of delivering this kind of treatment. So I think this pandemic also taught us we have to reevaluate our practice. So in terms of do we really need to deliver the only regimen that we have? We can always look at an alternative, a shorter regimen which may not be so immunosuppressed, so that you can consider for a suitable patient. But I think by saying all that, it's important that we continue to evaluate ourselves and look at other innovative way to mitigate and combat and fight this infection.
Excellent, Dr. Yap. That was really nice insight about breast cancer. Now, Dr. Alan, do you have anything to add? I mean, from the perspective of a hematologist, treatment of lymphoma patients, what is your say?
For lymphoma, I think the public needs to be aware. I mean, it is not a single disease. It's actually many types of lymphoma. So you've got very slow growing lymphomas, which may not need treatment, to more aggressive ones, which need urgent treatment. And the pandemic has taught us that also, like what Dr. Yap alluded to, for those who need treatment, we can actually choose. You know, in some cases, treatment can be deferred because there's nothing urgent. For the indolent ones, you can delay treatment. But for the more aggressive disease, you can treat. But treatment options also can be using less immunosuppressive regimens. There are some very aggressive treatment like bone marrow transplant for lymphoma patients, whereby the timing is flexible. So in the peak of a pandemic, we may decide to postpone the bone marrow transplant, for instance. So all these things make us think, we need to tailor to the individual type of patient, the individual lymphoma, and so on. And the innovation, we've come a long way for treatment of lymphoma. It's not just chemotherapy, radiotherapy. It's also immunotherapy with monoclonal antibodies, with oral treatments, targeted treatment. It's very personalized medicine nowadays. So, there are a lot of choices. For monoclonal antibodies, we can give intravenous infusion, which means the patients spend longer, more hours in hospital. But nowadays, there are newer subcutaneous formulations also, which allow the patients to spend much less time in hospital. So in and out, so to speak. But a lot of treatment delivery still has to be in hospital. But if an oral regimen is available and the patient actually can see the doctor, get the medicines and go back, that's even more preferable. But we have to examine the choices and make individualized choices in the light of what the patient has, as well as what the current status of the pandemic, which is ever changing. Okay, hopefully it is coming down now. Hopefully we don't see another second wave, but we don't know. Okay.
Thanks, Dr. Alan. We really hope that there's no second wave of COVID-19 or so in our country. And okay, now let's take a step back and focus on the overall picture, looking beyond cancer treatment. We know that adherence to cancer screening by otherwise healthy individuals allow early detection of disease and reduces risk of premature deaths due to cancer. We are also aware of the fact that cancer screening, including breast cancer screening, colorectal cancer screening, and cervical cancer screening, for instance, has taken a bigger hit from the pandemic. Nonetheless, practical solutions have been found in other parts of the world. So for instance, in the US, home-based stool tests for colorectal cancer screening is increasing in popularity, as well as use of HPV self-testing kits for cervical cancer screening. So in your opinions, what are the other best medical practices that have been put in place with respect to cancer care that we can adopt in the Malaysian settings as a norm post-pandemic? That means we take out the positives that came out of the pandemic, and how are we going to, can we adopt give us some examples, what else can we do and to be continued post-COVID pandemic? Dr. Yap, do you have anything?
I think one thing that quite noticeable in my practice is that, instead of patient come to my clinic and they take a prescription and go to pharmacy to get their prescription, actually, they phone my clinic and then we can write a prescription, they can pay online, and then the pharmacy will send them the prescription. So I think it's innovative, you can send the medicine by post rather than they have to come to hospital to collect their medication. And that is, I thought, for my practice, is something which is something relatively new, because you think about, in the past, patients always have to come to clinic and collect their prescription, but now you can do it online, send it, and then by post laju and so on. So I think that's quite good for patient, and they don't have to come. So apart from that, there are other you say testing tools. Unfortunately, mammogram and ultrasound breast, you cannot do it at home. Unfortunately, I think you still need to come to hospital for the screening. So I don't think there's any way out for that. You can't really do it at home. So it's still a technology that we need to screen.
But do you think that then women who are due for screening. So you think that they should make a call? What's your recommendation for women who have had thoughts about going for breast cancer screening, for instance?
I think they should. All the clinics that carried out screening will continue to screen patients. So I don't think they should delay this because I think if they have their concern, they should discuss with the clinic nurse, perhaps could address some of their fears. And also, I'm sure all healthcare clinics, healthcare facilities, they are geared up in terms of following standard operating procedures in terms of how to mitigate the infection. So I think, as long as they follow the SOPs, I think it should be safe because as Dr. Alan mentioned in the past, the Ministry of Health has done a great job in mitigating the infection. And I think the risk of infection is relatively low in this country compared to other countries.
Thanks, Dr. Yap. Dr. Alan, what about your take? What are other best medical practices that have been put in place in terms of cancer care that you think we can adopt post-pandemic?
I think the pandemic has seen a surge in digital health, and teleconsultation has taken off like a storm, and everybody's adopting it now. And I think rightly so, because it's the ultimate form of social distancing. If you don't come to hospital and you get to consult your doctor online, is something which many doctors or patients have not considered until now. And it has taught us that many clinic encounters, it's actually conversational, and you do not need when you do not need physical examination, where you do not need to come for a particular scan or blood test, which can be done only in hospital and not a lab somewhere else. And I think we can actually conduct this online. For example, it could be discussion about some treatment options or some regimen they're unclear about. Sometimes family counseling, which is so important. You can do it online with daughter in Penang, son in Singapore, or the patient is residing in Kuala Lumpur. And the digital health has actually made this very doable. And it also taught us that it increases the efficiency. I think the day and age where, say, you have a biopsy report or you have a blood test, which doesn't come out immediately, but a week down the line, you don't have to come back to the clinic just to get a report and discuss it with the doctor. You could do it online, for instance. So not all, but some of the things can take place online, and it makes things more efficient, just like the home drug delivery, which Dr. Yap alluded to. I mean, it just takes this pandemic for the hospital to realize how to make things more convenient and easy for the patient, and not just that, safer too. Yeah. Home care still may be a long way off, but I think digital health or teleconsultation has actually enabled the doctor to make virtual home visits. So sometimes it has helped us, and I have done that also, being able to actually see how the patient is doing at home and be able to check with the patient or his or her relatives as well, and actually address any concerns that they might have. So this also saves traveling for the patient, and in this time, anything which cuts off travel is a good thing. Yeah. So I think this has taught us, and it will stay. I think like telehealth, teleconsultation is here to stay, and it's going to grow, and more things will come, I think, only for the better good. Sorry, I can't hear. Yeah.
Sorry, Dr. Alan. I did realize that I muted myself. Okay, let me repeat. You said about your experience conducting teleconsultation and telehealth and so on. Are all your patients open and are they happy with the experience, or do you also get patients who are not comfortable and what is your advice to them? You know, you said that it allowed you to look at how they live, speak with their relatives. So what are the positive aspects that you would like to share to patients who are a bit hesitant, perhaps, you know, or a bit worried about consulting their doctors by telephone or online?
There are concerns on both sides, both concerns on the patient, actually concerns by the doctors as well. For patients, I think my take is that a lot of it is actually a little bit of technical hurdle they have to overcome. They are scared of new technology, something new, and they're not. It's anything unfamiliar. So if you do not know how to work something, it's not clear. But the younger ones, I find actually they take to it very easily. But the system, if in place, if it's very easy to use, if it runs off your smartphone or your iPad or just a laptop, no need to install any app. This will make things easier. I think, and the telemedicine providers have made it easier and easier for patients and doctors alike to use. So the learning curve is not so steep nowadays. The other concern is some people are worried, what can you do? The doctor cannot examine the patient. I mean, this is also doctor's concern. I can't physically examine. We doctors forget we do examine, we can visually examine, and there's auditory examination as well. It's just the physical touch is not there. But there are a lot of teleconsultation sessions which do not require physical examination, like I talked about. If it's just counseling or it is a discussion about some lab test report, etc. So these can actually replace the clinic visit. But when physical examination is required, then the doctor will defer and say, hey, you need to come to the clinic, I need to actually examine you properly, and we can't do this online. I think be assured that the doctor should be telling you, this should not replace a clinic visit. So you can't tell the doctor, I've got pain in the tummy, what could it be? And the doctor can't examine you. It's just not possible. So certain things are possible, certain things are not currently. But there are definite technical hurdles, but I think they're getting easier and easier. Yeah.
Thanks, Dr. Alan. Dr. Yap, can I ask you, what is your experience with using telemedicine, and is it any different from Dr. Alan?
To be fair, I haven't had any requests from patient, in terms of this kind of Zoom-like telemedicine, although the facility is available. So, mainly, in my practice, I think most of my patients who are on active treatment and they need to come. In terms of like consultation, usually I need to examine them. So I think, certainly, I think that this pandemic, what has taught me is to as I said, reevaluate, and maybe I have to start looking at this technology, and telemedicine is complementary to the face-to-face consultation. So I think I haven't had many experience, although I have spoken to them on WhatsApp and so on, but that's not really true telemedicine that we'll be talking about. It's a proper platform that patient and even relative can join in terms of you have to arrange a suitable time for that consultation. And the other thing that it taught me from this pandemic is that we as I said to you before, we reevaluate our practice, my own practice. Sometimes I look at my own, say radiotherapy technique, and rather than patient have to come for 5 weeks treatment, can we do it less? So we can kind of reevaluate everything. And also, patient nowadays, my impression is they're actually looking after themselves better than before the pandemic, because the fear of the infection. So they're actually eating better, sleeping better, adhere to their medication, they're taking their medicine on time, and so on. So I think it has changed all of us.
Okay, thank you so much, Dr. Yap and Dr. Alan. We have a lot of questions lined up for us, so I will stop asking the questions, and let's look at some of the questions that have been put forward here. So what I see here is, can cancer patients come into contact with a recovered COVID-19 patient? What are our risks? That's a question that has been posed. Dr. Alan, you want to say something?
Well, the whole issue is whether these patients are, the COVID-19 patients are still infectious. And this is an area where we are still learning how infectious patients are. We just learned that, asymptomatic patients, there's such a thing as asymptomatic and pre-symptomatic. So you may have no symptoms, but if you're pre-symptomatic, you are probably more infectious than asymptomatic ones. And then if you have the infection, you can still test positive after your symptoms have abated. But whether this test means they are still infectious, probably not so much. I think if they have infection quite a long time ago, they're probably no longer infectious. I think, how long, I'm not a COVID-19 expert, but you probably wouldn't want to come to contact them within probably a few weeks, maybe. But if it's like 2 months ago, it's probably quite safe. But, the thing is, there are pre-symptomatic and asymptomatic people walking around as well. So, we still have to, whatever it is, I think the basic precaution is social distancing, hand hygiene, wear masks if you're in the enclosed space with other people. Whether or not they've had infection 2 months ago, whether they had infection, they don't know, they're maybe minimally symptomatic. So just take the precaution rather than, we can't be testing everybody. I think the government is doing the right thing by selective testing, but just take the precautions and keep safe,
Okay, and I have another question here. Hi, any interaction between cancer medication taken by cancer patients and the COVID medication given in hospital? Dr. Yap, can you address that question?
I think it depends on what type of anti-cancer medicine, If this is chemotherapy, I think if somebody with active COVID-19 infection, the chemotherapy would have stopped, right? So if they are just taking tablets like hormonal therapy for breast cancer, certainly I don't think that's an issue. And there has been sort of increasing evidence recently. I mean, I was looking at one very published publication that, what the type of anti-cancer treatment affecting the interacting with the COVID-19 risk and so on. But I think when they adjust for age, gender, and comorbidities like hypertension, diabetes, the cancer treatment itself does not appear at this moment that it has that particular risk. But we're still learning. We still don't know a lot of things, right? So I think again it comes back to discussing with your doctor about I think hormonal therapy certainly is safe, right? For any other immunotherapy active treatment, then most of the time the oncologists would advise in terms of whether you should stop temporarily until the infection is being treated, then you continue with the treatment. I think the best is to discuss with your doctor, really.
Okay, thank you, Dr. Yap. For the next question, also for Dr. Yap. So in reference to active treatment, does this include the taking of targeted therapy? Is that considered as being on active treatment?
Certainly, yes. I think if you are on targeted therapy, again, as I said, there's been very large sort of meta-analysis, the post-study that's showing that they're taking targeted therapy and even chemotherapy. It depends on the fitness of the patient. I think age and other comorbidities are important factors, right? So, by taking the targeted therapy on its own, if you are otherwise healthy and relatively young and fit, and I think it's important to continue medicine under the advice of your oncologist, really. I think you should not just stop the medicine on your own accord. Certainly, if it's a mild infection, most of the patients with COVID-19 have mild symptoms, right? Some of them are asymptomatic, and some of them are very mild viral symptoms. So, they don't need to stop their targeted therapy. I think usually there are tablets for. So I think again, it comes back to discussing with your doctor, really.
Okay, thank you, Dr. Yap. There's another question. Any challenges in breaking bad news through telemedicine? Dr. Alan, can you offer your insight?
I think, when it comes to breaking bad news, to do it when it's very distant, without the ability of being, it's difficult to express support, empathy, even there's physical touch involved when you trying to break bad news to patients or relatives sometimes. So through teleconsultation, is maybe there's a sense that it's a little bit more impersonal, but it depends on how well the doctor has established a doctor-patient relationship with the person you're talking to. And so the distance may not matter. But, I think it's really for the doctor to gauge how suitable it is to break the bad news through teleconsultation. I mean, it's certainly better than a text message or even a phone call where you can't see the person. But at least a face-to-face teleconsultation, you can see, there are a lot of visual cues, you can actually engage better with the patient in a proper face-to-face teleconsultation platform. So it is possible, but again, we have to sort of gauge the situation, and perhaps it may be better to call the patient to the office with proper support from his or her relatives when breaking the bad news. So it's maybe and maybe not.
Thanks, Dr. Alan. Just following up with that, another question. Can telemedicine without clinical treatment work?
Telemedicine is not all about diagnosing and treatment. So I think that has to be clear. There are a lot of aspects to telemedicine, of which teleconsultation is only one of them. So teleconsultation, we are actually talking with the patient. Sometimes, when we take the history from the patient, 90%, over 90%, we can be pretty sure of the diagnosis. But because without that ability to examine the patient thoroughly, we may not be so sure. In that case, the patient will be told to come to the clinic, and then we can actually examine thoroughly and get the diagnosis with a greater degree of certainty. But it is not all about diagnosing and prescribing medicine. I think that's the wrong concept about teleconsultation. I mean, as far as cancer treatment, a lot of times the patient has left the clinic, goes home, and then, I forgot to ask this question. So I have a patient with, for example, stage 1 lymphoma, and he has a question to ask whether can his treatment cycles be reduced to 3 or 4 rather than 6 cycles? And then he has this burning question. So, all right, he's not due to see me for some time. So he schedules a teleconsultation session, and then we address that concern, and then he ends up happier with his questions answered. So, it's not all about treatment. There's a lot of counseling involved, and there are other things like I said earlier. We just convey lab results without patients having to come back to the clinic just to collect the result and discuss the results with your doctor. So there are many things where digital health and teleconsultation can help make the delivery of healthcare more efficient.
Thanks, Dr. Alan. I have a question. I think I will direct this to Dr. Yap. What kind of public-private collaboration has taken off since MCO until now? Are you privy to that?
I think certainly, we know that, we do all the patient who come to private hospital for treatment, and they are screened for COVID. If there is any positive cases, they have to be directed to a government hospital facility, right? So, we have to collaborate with them. And also, if let's say our patients, like cancer patients who are diagnosed with COVID and then they're treated in the government facilities, then we have to engage with the treating physician in the government hospital, and we still continue to collaborate. Now, in terms of other private public partnership, I'm not aware of any initiative. I don't know about Alan. Do you know any initiative? But I'm not aware of, actually.
I don't think there's any formal partnership, but certainly whatever we do is in our patient's interest. So for example, if you can't get a PET scan or something early enough in a public health setting, we do help patients if they can arrange to have an earlier scan in the private healthcare setting. So we do I think we help patients that way to optimize the healthcare delivery. So, it's a mix and match scenario, but ultimately to help the patient. But I don't think there's any formal arrangement, so to speak, unless like something breaks down on one sector and then the government has to outsource the service to another setting. Yeah.
I think there was talk about when we were at the peak of the pandemic, they were concerned about not enough beds in the public hospital, and the private hospital were sort of preparing themselves to receive patients who are non-COVID from the public hospital. So I think that there was a lot of discussion on that, but fortunately it didn't happen because we didn't do. Yes.
Yes, I think like the private sector offered ventilators for their non-COVID patients who need ventilators, and taking off the load of non-COVID, because the government had pinpointed certain particular hospitals. You need the expertise, you need infectious disease specialists and so on. So specific hospitals were designated to look after COVID-19 patients, but the private sector would take the load off the government hospital for non-COVID. But I think the whole thing has been managed very, very well by the Ministry of Health. And thankfully, we've really flattened the curve, and the government hospitals were not overtaxed as far as I know.
And I believe cancer surgery as well. There were some collaborations, from public hospital because a lot of the cancer hospitals were in fact COVID hospitals as well. So there were collaboration in that sense for cancer surgery, where some private hospitals took up some of the surgical cases to be done. And let me move on, because we still have some questions. And this one is for Dr. Alan. For lymphoma patient, if we are on IV medicine, should we change to oral form medication?
This is it's very hard to answer this question, because as I said, there are many types of lymphoma, and there are different types of treatment regimens which are available. For certain types of lymphoma, an oral substitute may be available, but for your specific type of lymphoma, best discuss it with your hematologist. Okay, there may or may not be an oral formulation which is available, but if it is available, it's something to discuss with. It may be an option where during the midst of a pandemic, which allows you not to come to the hospital so often, and have something which you can take at home. So it really depends on the type of lymphoma.
I have a similar question where someone actually asked about non-Hodgkin's lymphoma, Dr. Alan. The same question. Should I go for IV medicine or change to oral medication?
Even non-Hodgkin lymphoma, there are many types. Okay, there's follicular, mantle cell, marginal zone lymphoma,
so it depends,
or more aggressive. It really depends on the
chat with the doctors.
Yeah, so really we can't give that kind of advice, but talk to the hematologist and discuss what options are available. Yeah.
And there's another question. What about patients from remote areas who do not have access to teleconsultation or not familiar with the technologies? How else can we reach out for screening, diagnosis, treatment? How to move forward in this era?
Maybe I can answer that. As far as remote are concerned, I think, a lot of Malaysia is covered now by fast mobile data, internet. Maybe that unfortunate student in Sabah who had to climb a tree to get a good signal, that may be the exception more than the rule. But I see almost every Malaysian has some form of smartphone now with mobile data. So there is increased accessibility, though there might be some very rural areas who do not have that. I think the government is really trying to reach out and address that, and digital health will expand. And that I'm convinced. People know how to Google already, and they come very well prepared to the clinic with lots of questions after Googling their diagnosis and symptoms even. So yeah, I think it's the era of the technology has reached out to the masses, and I think the coverage is increasing to such an extent that it's only the minority who do not have it.
And I think, can I add maybe for instance, screening, non-governmental organizations, they can play a part, and we already have some societies reaching out for people who are, have problems accessing the technology and so on. So I guess not only public-private partnership, but also partnership with non-governmental organizations, all that may be helpful. And we only have, Dr. Alan or Dr. Yap said something. Do you all have anything?
So I just
to
said
add?
something. I think Dr. Yap mentioned that the actual screening, unfortunately, for certain things like breast and so on, needs to be done in hospital. But digital health tools may reach out to those to, for example, as reminders or recalls, so that they don't miss the follow-up for their pap smear, their mammograms, etc. Even though you can't screen at home, but at least the tools are there to remind the woman.
To remind,
Yeah.
Okay. That's
what I like to add is that, I would like to add that telemedicine is good, it's here to stay, but it is complementary to face-to-face consultation, because you cannot replace the physical examination. So I think, it is complementary, and I think, it's good to, if I were to use telemedicine, I would use that to discuss, let's say, blood test results and so on, and in advice in terms of adjusting their medication dosage and so on. But let's say, if I need to examine them, if they have a particular symptoms, then I think telemedicine, is lacking of the, you can't examine
of that human touch. Yeah,
exactly. Yes.
Dr. Yap, there's a question here. My dad is a prostate cancer patient and he has concern going to hospital for his 3 monthly injections. Is it risky going during this pandemic, or is it all right to miss one appointment?
It is not all right to miss appointment, and certainly I have patients who are on 3 monthly injection. This usually they're the subcutaneous type of injection for the prostate cancer. It can be delivered locally. If you have a GP who is very active, you can actually advise. This technique is not very particularly difficult. I have patients who actually got their local doctor, somebody they trust, to deliver that injection. Not necessarily they have to come to hospital, but obviously this is a short-term solution in terms of we still have to examine them and look at their PSA result and so on, right? So again, looking at PSA result, you can do a consultation. But I think 3 monthly, I would not advise to defer because the level of the drugs will be gone. So I think you need to stick to the treatment schedule.
Oh, thanks, Dr. Yap. And we only have 2 more minutes, and there's a question about use of mask, which I think I will take. So there's this question on the face mask I use is a 3-ply mask or 4-ply mask. Does it mean that the more ply, the more effective the mask? So with respect, if you are a cancer patient and you are going to a hospital, or you are in a situation where you have to leave home and you think that the risk of getting infected from another person is very high, please stick to the surgical mask. Because the reason I brought that up is because someone also asked whether a lousy inferior mask is still better than wearing a proper quality mask. So with respect to cancer patients, it's best to stick to surgical mask, which is actually 3-ply. But it doesn't mean that the more ply you add beyond 3-ply is going to be more effective. If at all, it's going to be more difficult to breathe. So would Dr. Yap or Dr. Alan want to add to anything that I said about the mask?
I've seen patients go to the extreme, wear masks, face shield, gloves, and I think it's all too really excessive. The masks, to be really protective, need to be very high quality, like N95. We are talking about inward protection, and the masks which the public is supposed to wear are probably more for outward protection to prevent droplet spread and so on. But I think generally wearing masks when you're coming to a closed area like the rooms and so on, you probably a good idea. But I think social distancing and hand hygiene is far more important. But between 3-ply, 4-ply, I think 3-ply is probably good enough.
It's good enough.
Yeah.
I mean, I have a patient who actually came to see me in a mask, and then he was telling me he's very breathless. And then I said, why don't you try taking your mask off? And when he took his mask off, he was actually quite well. So I think, you have to be sensible sometimes, right? You have to be sensible. I think 3-ply as a general rule is good enough. I think, 4-ply, I think sometimes it's too thick, too uncomfortable. It's not practical.
Okay, thank you, Dr. Ya. I see that we have reached the closing, and I have one more question here. Maybe I'll read that out. Delayed cancer screening may cause delayed diagnosis, and patients may present with more advanced symptoms. How prepared are we in facing this increase in new cancer diagnosis post-COVID-19?
May I say, pre-COVID is also already a problem. We see people delay their diagnosis, even with early symptoms, for many reasons, including fear of coming to the hospital, running around looking for alternative treatments which don't work, maybe because they have fear of chemotherapy or perceived terrible effects of cancer treatment, and so on. So we've seen patients with early stage disease go on to more advanced stage disease. But generally, cancer in general, if you need treatment, the earlier the stage, the better the chances of cure. So seeking proper treatment, proper diagnosis, and the best management early on, it's important. And they should not delay this just because of COVID-19. I think the cancer has greater priority than COVID-19 with all the precautions which we've talked about. There should be no fear of coming to hospital, right? So I think.
I totally agree. I think they should not fear of coming to hospital. They should get their cancer treated. If they have symptoms, they should seek medical help early rather than later.
And we are encouraging everyone to come forward, yeah? So do not delay, and we are ready. So because the question was asking whether are we ready to accept, accept this surge in cases or whatever not. So whoever who have doubts, who have symptoms, they should come forward, irrespective of whether it's during COVID. It's better to come now than waiting for the COVID to be over, because it's going to be with us for some time. So I guess that is something that we have to keep on stressing to patients as well as prospective people who have symptoms, who are doubtful to come forward. Any parting words, Dr. Yap, before we end the session?
I think I would say that the pandemic has taught us many things. We have to look after ourselves. The patient will look after themselves. We have to reevaluate our practice and adopt all the innovative technology that is around us now to help us to fight and mitigate the infection and to improve our practice, and hopefully, to mitigate the infection in cancer patients. And we want patients to come forward for treatment.
Thanks, Dr. Yap. What about you, Dr. Alan? Any parting words?
Yeah, I think that's what Dr. Yap said is what I echo. Just another appeal to patients: don't delay or defer treatment without consulting your doctor first. And I'm a strong advocate of digital tools and digital health. So this is something patients and doctors alike should not be afraid to utilize. And I think it's here to stay. Teleconsultation, telemedicine is here to stay, and it's something we need to explore and grow in the future post-COVID. Yeah.
Thanks, Dr. Alan. So I think we have come to the end of the session. So for all the participants, please help us to fill up the poll, which will pop up on your screen. It will help us to improve our future sessions. And with that, I would like to say a big thank you to Dr. Yap and Dr. Alan for being with us here today. We learned a lot. And to all the patients and the family members, caregivers, and the general public, please take note of whatever advices that have been given today, and let us hope that we can tackle the problem of cancer and get more patients to be diagnosed early and treated when we have more people surviving and living well with cancer in Malaysia. So with that, thank you so much. And don't forget to fill out the poll. Bye.
Are we offline?